When the novel coronavirus hit the country, everyone was scared on how to deal with it, and as nervous as everyone were the doctors required to put the oath they took serving humanity against all odds into perspective. And after 1 month into dealing with the deadly virus, health workers were heroes in the eyes of Kenyans and even leaders who took the initiative to recognize the selfless act by our health frontiers by clapping each and every Wednesday as weeks went by. But this did not last, as the health soldiers taking the bullet for serving humanity suffered slowly and silently. And in July the 13th, the first gallant health soldier breathed her last. DOREEN LUGALIKI lost her battle to COVID-19. Until her death, LUGALIKI was a gynecologist who was hailed by many. Of her patients and colleagues. From then, henceforth, the country has witnessed 13 doctors lose their fight to COVID-19, with the latest one being 28-year-old Stephen Mogusu, whose death has caused an uproar among Kenyans who believe that doctors and health workers have been neglected by the government, given the fact that they are in the front line in the fight against the pandemic.
Healthcare workers in this country have raised grave concerns on their plight and the hazardous working environments in the times of COVID-19.
Other doctors who have succumbed to COVID-19 are Dr. Ndambuki Mboloi, Dr. Daniel Alushula, Dr. Vladimir Shukin, Dr. Imara Ashraf, Dr. Robert AYISI, Dr. Hudson Alumera, Dr. Faith Mbumba, and Dr. Jacqueline Njoroge. Solidarity. By September this year, it was evident that doctors and nurses had suffered enough and threatened to strike if their demands were not met.
Doctors will not embark on a suicide mission. That is clear, and we have said it.
Some of the demands were quality protective gear, comprehensive medical insurance cover, salaries paid on time, promotions, and a compensation package. The doctors also called on the government to hire 1,000 more unemployed doctors to bridge the gap in the health services. However, frustrations among health workers peaked after a recent television expose that accused dozens of business leaders and government officials of corruption, alleging that they stole funds meant to be used in mitigating COVID-19 in the country. This has led to thousands of PPEs lying idle in coats of dust at KEMSA offices, leaving health workers to overuse the ones they already have or use none at all.
We've had discussions with the KEMSA management to be able to come up with a modus operandi of how these PPEs will be able to get to the counties. And one of the things that we have to do is ensure that we have endorsement at cabinet in form of a cabinet memo. And so that process, I'm glad to report, is currently underway.
9 months now into the pandemic, and the country has lost 13 health workers who endeavored to take part in the history of the fight against COVID-19, and whose families are left to mourn the once lauded health workers that have been left to wallow in pain and agony. And if nothing is done soon, more health workers are set to get into the COVID-19 death statistics and leave the already dented healthcare sector on its knees. The tens of health workers who have succumbed to COVID-19 are not just numbers, but Kenyans who have died serving their country. Georgina Magondu, K24, Nairobi.